This July will mark 6 years since Joseph Mann was killed on the streets of Del Paso Heights by Sacramento police. The 51-year-old had been spotted in the area with a small knife, talking to himself. And when law enforcement arrived and tried to de-escalate the situation, Mann ended up being shot 14 times while running away from police on scene. He was having a mental health crisis. Those who dialed 911 that day to report his concerning behavior only had one source really to reach out to: law enforcement. Now, Sacramento County is crafting a new way forward for everybody in the community, so if another situation like that happens in the future, the person in crisis gets the help they need. Here live to share what's being done to better address behavioral health crises is Alondra Thompson, the health program manager for what's being called the WCCRT, the Wellness Crisis Call Center and Response Team. Welcome to Fox 40 News at 11.
Thank you. I'm glad to be here.
This effort that's launching is being billed as an innovative 24/7 option that can change the lives of people having some kind of episode due to mental illness or substance abuse. It will require massive organization because right away it's tackling one of the biggest critiques of other response programs out there. They may run 9 to 5 or 2 to midnight, and you can't really put a clock on when someone may be in crisis, can you?
You cannot. I'm so happy to say that this is a 24/7 program. And we are so excited to let you guys all know that this team is all about behavioral health services, connecting our family and community to behavioral health services and opening up this system, getting rid of that gap. 24/7, we will always be available to provide this service.
To staff this up, the County of Sacramento is looking for folks with energy and compassion, with clinical, professional, or lived behavioral experience. That's a quote from the ad. Does this mean you might take on someone who's been in treatment for, say, schizophrenia, or who's been clean or sober for a number of years, that lived experience?
It does. We've been driven by our community, and our community is saying we want someone to reflect who we are when they come and provide services to us. So those who have schizophrenia or maybe dealing with substance abuse or have had history of dealing with this, they have that familiarity, understanding, and they can make a safe place for those who are in the community that need to have someone to talk to, where they may have felt alone. Now they can see that there is someone that has suffered and survived and is thriving in their lives that will support them along with one of our counselors.
That's really the added value of that diversity of experience on the team. How many people total between the call center and the teams that will be deployed all across the county are you looking to hire?
Over 50 staff new members. We are so excited about this, and we want everyone to please, if you feel an interest in the work that we're saying we're going to do to provide to our community, please check our website out and apply.
Once assembled, it of course will take a while for the community to plug in and buy into this as a resource, and we all know that buy-in is very important when new programs start. Some people might still be calling the police first. These response teams are described as providing immediate intervention, able to help de-escalate situations, but some people might be suspicious that they would be working with law enforcement, that the teams would be working with law enforcement in the nature of maybe handing over the subject of one of these calls later on over to officers. Is that going to happen?
We are working extensively with the community. They are our advisory. They are driving this program. They are letting us know what works for them, how they will be willing to reach out and make this call. That's why we're here. We're the alternative to that 911 call, where you can call those who are working with behavioral health services and can support you. And because it's being driven by the community, they will be ongoing advisory to our program, letting us know what's working, how we can improve, and any learning opportunities that we can share. But this being by the community is aware and trusting that they have the voice, and they know that they're going to be bringing it to our community.
And with them having the voice, just to be clear, so should someone, as they pick up the phone and start to dial you all, be afraid that that is the same thing as calling law enforcement, or are you wanting people to know that this is very separate?
I want people to know that this is very separate. We are 100% behavioral health services. Our clinicians, our professionals, and our persons with lived experience are all about what the community is asking for, that they have someone else to call outside of law enforcement for mental health crises.
And folks just need to go to the county website, right, and apply. And then when do we think the team will be in place and operational?
We're hoping by this summer. We want our team to be really that team of diverse culturally and extensively at what the community is asking for. So we want to take time and be very clear on how we do our hiring. So this is what we're hoping by this summer.
All righty. Well, we've been showing a little bit of the website where somebody would need to go to apply. Also, not just clinicians and professionals, but people with lived experience. And we're going to be linking all of that information to our website, fox40.com. Thank you so much for coming in to explain this new resource that people really have been asking for years in this area. Thank you.
Thank you.
A Thursday night shooting sends